So now we have one last module in the heart. We're going to see the interior of right atrium, interior of right ventricle, and the nerve supply of the heart. Now first we're going to see the interior of the right atrium. Now see the diagram. Now we opened the right atrium. How, sir? Where we gave incision. Now we gave incision from the opening of superior vena cava to the opening of inferior vena cava. So if you put incision there and we opened the right atrium. So right atrium, it is having two parts. Now this is anterior, I am writing as A, and this is B, posterior. Okay. So if you open the right atrium, so we have anterior part and the posterior part. Now the anterior part of right atrium, it is derived from the primitive atrium. It is coming from the primitive atrium. The posterior part of right atrium is coming from, yes, we know, it is coming from body and the right horn of the sinus venosus. Right horn of the sinus venosus. Okay, so the posterior part of right atrium is coming from the body and the right horn of sinus venosus. The anterior rough part is coming from the primitive atrium. Now see the diagram. The anterior part is rough. You see numerous small muscles there. That is anterior rough part. Anterior part is rough. Now see the posterior part. Posterior part, we are not seeing any muscles. Okay, so the posterior part is smooth. So anterior part of right atrium is rough and the posterior part of right atrium is smooth. Okay, now exactly between the anterior rough part and the posterior smooth part, we have one structure called crista terminalis. Now this is our crista terminalis. So crista terminalis, it is present between the anterior rough part and the posterior smooth part. Okay, right. Now in the upper part of crista terminalis, please put one bracket. In the upper part of crista terminalis, we see the SA node. SA node is present at the upper part of crista terminalis. What is present? SA node. Now we have one more location for the SA node, that is opening of superior vena cava into right atrium. So they can give any of this. So SA node is supplied by 65% of the cases, it is supplied by right coronary artery. 35% of cases supplied by circumflex artery. I hope you know that. Now, where is our SA node? SA node is present at the upper part of crista terminalis or at the opening or junction of the opening of superior vena cava into the right atrium. Okay, right. So that's all about the crista terminalis. Now see the anterior rough part. See, in the anterior rough part, we see numerous muscles. Now these muscles are called pectinate muscles. So pectinate muscles are present. There are numerous small muscles present in the anterior rough part. Numerous small muscles present in the anterior rough part. Okay, right. Now what about the posterior part? Now posterior smooth part, which receives three veins. What are those? Now the posterior smooth part, we seeing the opening of superior vena cava, opening of inferior vena cava, and opening of coronary sinus. So three veins open into the posterior smooth part. So please write three veins which open in the posterior smooth part of right atrium. What are those? Superior vena cava opening and inferior vena cava opening and coronary sinus opening. Coronary sinus opening. Okay. So superior vena cava opening does not have any valves. We don't need any valve for the opening of superior vena cava. Why? Because the flow is towards the gravity. So again, we don't need any valve for the opening of superior vena cava. But inferior vena cava opening and the coronary sinus opening, the flow is against the gravity. So we need some valve. So inferior vena cava opening is guarded by Eustachian valve. That is our Eustachian valve. So Eustachian valve is guarding the opening of inferior vena cava. And opening of coronary sinus, again, is guarded by Sebaceous valve. Guarded by Sebaceous valve. Okay? Right. Now, next, in the septal valve, we see fossa ovalis, and above and behind the fossa ovalis, we see limbus fossa ovalis. Now, these two are the structures. They are the remnant of interatrial septum. Now, please write fossa ovalis, and limbus fossa ovalis. Now, this is fossa ovalis. It will be like this. And above and behind the fossa ovalis, we see the limbus fossa ovalis like this. Now, fossa ovalis, this is fossa ovalis, and this is limbus fossa ovalis. Now, fossa ovalis is coming from septum primum. Septum primum, septum secundum, they are helping the formation of interatrial septum. The septum primum regress and forms fossa ovalis. So, septum primum regress and forms fossa ovalis. So, fossa ovalis is derived from septum primum. Limbus fossa ovalis is coming from septum secundum. Septum secundum. Okay? Right. That's all about the fossa ovalis and the limbus fossa ovalis. Last feature in the interior of right atrium is the triangle of Koch. So, to see the boundaries of triangle of Koch, we have to mark 3 areas. Now, this is A. So, A is nothing but that is the opening of tricuspid valve. Opening of tricuspid valve. Okay. Now, B, it is the opening of coronary sinus. Now, this is B. B is opening of coronary sinus. Okay. And this is T. C. Now, C is tendon of Todaro. C is tendon of Todaro. Now, if you connect these 3 points, see the diagram. So, if you connect this A, B and C, we get one triangle. The triangle is called triangle of Koch. Okay. So, triangle of Koch is formed by joining 3 points. What are those? The opening of tricuspid valve, number 2, opening of coronary sinus, and number 3, tendon of Todaro. So, if you connect these 3 points, we get one triangle. The triangle is called triangle of Koch. Now, why we have to know the triangle of Koch? What is its importance? What is significance? Now, triangle of Koch content is AV node. AV node is present inside the triangle of Koch. That is why they are asking this question. Okay. Now, one time, the NEET exam, they gave this question. Again, very old exam. Very old NEET exam. So, what is the blood supply of triangle of Koch? I told you, AV node is present inside the triangle of Koch. So, AV node is supplied by? Very good. The septal branch of AV node is supplied by the septal branch of posterior interventricular artery. So, post-interventricular artery supplies the AV node. So, post-interventricular artery septal branch supplies the triangle of Koch. Clear? Right. And by this, we are completing the right atrium. Next, we're going to see right ventricle. Right ventricle is very simple. It's not that much complicated. Now, again, we opened the right ventricle and see the right ventricle. See, right atrium, we divided into anterior rough part and the posterior smooth part. Now, here, we're going to divide the ventricle into inflow part and the outflow part. Inflow part and the outflow part. Now, inflow part which receives the blood from the right atrium. Outflow part give the blood to the pulmonary trunk. Now, see the outflow part. The outflow part is smooth. The inflow part is rough. Yes. Now, inflow part, it is coming from, derived from the proximal 1/3 of bulbous cordus. Proximal 1/3 of bulbous cordus. Okay. Bulbous cordus. Whereas the outflow part, smooth part of both right ventricle and left ventricle, it is coming from middle 1/3. Middle 1/3 of bulbous cordus. Now, this part is also called the conus part of bulbous cordis. The conus part of bulbous cordis, which forms the outflow part or conus part of both right ventricle and left ventricle. Clear? Right. The inflow part, the rough part, is coming from the proximal one third of bulbous cordis. We don't have any specific name for this. Right. Now, between the inflow part and the outflow part, we see one linear elevation that is called supraventricular crest. So, supraventricular crest, which is present between the inflow part and the outflow part. Okay, the supraventricular crest, it is the linear elevation. It is the linear elevation which is present between the inflow part and the outflow part. Okay, fine. See, there is nothing to say about the outflow part. The outflow part is smooth, just coming from the conus part, the middle one third of bulbous cordis or conus part of bulbous cordis. If you remember that, that is more than sufficient. So the inflow part is rough, which contains trabeculae carneae. Trabeculae carneae. Now the trabeculae carneae, which contains ridges, bridges, and pillars. So ridges, bridges, and pillars. So we have three structures. Now ridge, I told you just now, ridges are nothing but they are the linear elevations, that is supraventricular crest. Supraventricular crest, that is forming the ridges. Example for ridges. Next, bridges. See, bridges, the end of the bridges connected and they are free in the middle, like a normal bridge only. So bridge means the two ends are connected and they are free in the middle. Now the example for bridges are septomarginal trabeculae. That is example for bridge. Now septomarginal trabeculae, which is extending from interventricular septum to the base of anterior papillary muscle. Anterior papillary muscle. Okay, so the septomarginal trabeculae is an example for bridge, which is starting from interventricular septum. This is interventricular septum and to the base of anterior papillary muscle. That is our anterior papillary muscle. So it is coming from intraventricular septum to the papillary muscle. Now what is the significance? Now this band, the septomarginal trabeculae, which prevent the over distension of the right ventricle. See, it is coming from the septum to the papillary muscle. So it prevents the over distension of right ventricle. That is why this band is also called moderator band. So which prevent the septomarginal trabeculae, which prevent the over distension of right ventricle. And that is why this is called moderator band. Moderator band. Okay. Now this moderator band or septomarginal trabeculae, which contains right bundle branch. So right bundle branch is present in the septomarginal trabeculae. Okay. And one last structure is pillar. Now the pillars are nothing but the papillary muscles. So pillar means the base will be fixed and the apex will be free. That is the pillars. So pillars, the base is fixed and the apex is free. This is base and this is the apex. So the pillars are formed by papillary muscles. Pillars are formed by papillary muscles. Okay. So papillary muscles. Now the apex of the papillary muscles, which gives attachment to the numerous thread-like structures called chordae tendineae. Okay. So the apex, which is giving attachment to numerous thread-like structures, they are called chordae tendineae. Okay. Right. Now next point. Now how many papillary muscle we have for right ventricle? Now right ventricle is having 3 papillary muscle. Anterior, posterior, and septal. Now left ventricle is having only 2 papillary muscle. Anterior papillary muscle and posterior papillary muscle. Okay. So that's all about the right ventricle. So very small topic. Now last thing is we're going to see the difference between right ventricle and left ventricle. Left ventricle having the same features with small differences. That is what we're going to write now. Now right ventricle and left ventricle. Just now I told you right ventricle is having 3 papillary muscle, and left ventricle is having only 2 papillary muscle. Next, moderator band is present. Moderator band is present in the right ventricle, whereas moderator band absent in the left ventricle. And right ventricle is thinner, left ventricle is thicker. Okay, now these are the basic difference between right ventricle and left ventricle, and that's all about the interior of right ventricle. Okay, so one last topic in the heart is the nerve supply of the heart. So heart is supplied by the superficial and the deep cardiac plexus. Heart is supplied by superficial and the deep cardiac plexus. So superficial and deep cardiac plexus. Fine. Now, why it is called superficial cardiac plexus and deep cardiac plexus? By their location only. The superficial cardiac plexus is present below the arch of aorta. So superficial cardiac plexus is present below the arch of aorta. Okay, it is superficial. Whereas deep cardiac plexus, which is present deep in front of tracheal bifurcation. See, this is trachea. Okay, so in front of tracheal bifurcation, deep cardiac plexus is present in front of tracheal bifurcation. In front of tracheal bifurcation. Okay, right. Now, what are these structures contribute to superficial cardiac plexus and the deep cardiac plexus? So now, superficial cardiac plexus and the deep cardiac plexus, they are formed by sympathetic and parasympathetic. Again, parasympathetic, sympathetic. Right side and left side I am writing. So this is right side and this is left side. Okay. Now, the sympathetic structures helping for the formation of the cardiac plexus. Number 1, superior cervical ganglion. Number 2, middle cervical ganglion. Number 3, inferior cervical ganglion. And number 4, T1 to T5. Right side, same on the left side. Your superior cervical ganglion, middle cervical ganglion, inferior cervical ganglion, and T1 to T5. The sympathetic contribution for the cardiac plexus. Now, what about the parasympathetic contribution to the heart? We have cervical cardiac branches. They are coming from vagus nerve. Okay. So, parasympathetic fibers are coming from vagus nerve. What are those? Superior cervical cardiac branches. Inferior cervical cardiac branches. And recurrent laryngeal nerve. Similarly, left side, superior cervical cardiac branch, inferior cervical cardiac branch, and recurrent laryngeal nerve, right side and left side. Now, these are the structures helping for the formation of cardiac plexus. I told you we have superficial cardiac plexus and a deep cardiac plexus. Now, superficial cardiac plexus, it is coming from superior cervical ganglion, this one, and inferior cervical cardiac branch from the left vagus. So, left side superior cervical ganglion and left side inferior cervical cardiac branch from the vagus nerve. Now, these two structures only form the superficial cardiac plexus. Remaining all structures, they help in the formation of deep cardiac plexus. So, please remember superficial cardiac plexus. No need to remember, no need to by heart the structures contributing to the deep cardiac plexus. 2 minus 1 equal to 1 only. So, please remember the superficial cardiac plexus. So, superficial cardiac plexus is formed by left side superior cervical ganglion from the sympathetic and left side inferior cervical cardiac branch from the vagus nerve. Now, these two structures, they help in the formation of superficial cardiac plexus. Remaining all structures help in the formation of deep cardiac plexus. Okay, and that's all about the nerve supply of the heart. And by this, we are finishing the heart. So, in the heart module, we started with the pericardium, and then we discussed the external features, And then we discuss the blood supply of the heart, artery supply, venous drainage, and we seen the right atrium and right ventricle interior, and finally, yes, the nerve supply of the heart.